Hello friends! In this video we are going to be going over the ear anatomy. First, as always, let's get oriented to what we are looking at. This is the ear, and then this is the internal workings of the ear. This would be the patient's right ear over here, because we're looking at it as if it is a patient and not ourselves. This here is the pinna, or another name for it is the auricle. This is the part of the ear that you can see just by looking at someone and not inside of the ear. Next we have the external auditory canal. This is with all the hairs and then the wax. This is where people like to stick Q-tips and their fingers or whatever else. Next we have the tympanic membrane here. It separates the external and the middle ear here. And the appearance when you look into somebody's ear, it should be like a pearly white. It should be shiny. Next, in the middle ear here, we have the ossicles, the malleus, the incus, and the stapes. I like to remember malleus because it kind of looks like a mallet, incus like a pen with ink, and then stapes like a staple. After sound waves are collected into the external auditory canal here, and then through the tympanic membrane, it vibrates these little bones here, and then it enters into the vestibule. This is the vestibule here, through the oval window. This is the oval window that the stapes connects to. The job of the vestibule here is to maintain the equilibrium of the ear. It also is responsible for noticing the changes in your head position. The fluid in the vestibule is acted upon by gravity, and that's how we know if we're tilting our head or not. Next, we have the semicircular canals. They're these three things right here. The semicircular canals respond to movement that is rotational. And the ampulla here, the ampulla are these little bulb-like things in the semicircular canals. Another thing on the vestibule is the round window here. So after the sound waves vibrate from the stapes through the oval window, through the vestibule to the cochlea. Here's the cochlea. The cochlea is responsible for converting these vibrations into the neuroelectrical signals that our brain can understand. We have some nerves coming from the internal ear. Here we have the vestibular branch of the nerve and the cochlear branch of the nerve. These two meet up to make our vestibular cochlear nerve, which is nerve pair 8. If you haven't watched the cranial nerve pair video yet, I'll link it down in the description. Here's the external ear. It expands from here to the tympanic membrane. The middle ear spans where these ossicles are here, and then the internal ear is the rest of it. Sound travels through here and then turns into mechanical vibrations in these bones here, and then travels through the vestibule, through the cochlea, into the nerves. If you open up the vestibule here, this is what it looks like. It has the utricle and the saccule. Again, these just help with equilibrium and helps us know if we have changes in our head position. If we open up the cochlea, this is what it looks like here. Inside the cochlea, we have the scala vestibule, scala media, and scala tympani. Next, we have the cochlear nerve here, as we see it here. And then we have the organ of corti. All of these just help with the transduction of sound. One other thing to note is the stapes muscle holds the stapes to the mid-ear, so that would be in here. That is it for the ear anatomy. Thanks for watching, and I'll see you next time.